This is Betsy. Betsy, I'm treating for her shoulder, but she came in today with this on her leg here and said that she can't walk. So go ahead and try to walk for us. So she has an old meniscal tear going on in her knee. So let's see if we can get some range of motion out of her and relieve some pain here.
Fixed in June of 2016. It hasn't bothered me since.
So in June of 2016, I had treated her for this, and they were talking about surgery, right?
Exactly.
And we were able to get it so you didn't need surgery, so that was 3 years ago. But now she comes in today with this issue. So she flared it up a little bit. So let's get a range of motion here.
Not a little bit.
A lot of it. She flared it up a lot of it. So go ahead and bend for me. So I'm only at 92 degrees of range of motion right here before pain stops you, right?
Yeah.
And on a scale of 0 to 10, how would you rate that pain?
13.
A 13 out of 10 pain. And point to me exactly where that 13 is.
Well, it's localized there when I'm not on it, but when I stand up, it's the entire unit.
Okay. All right, so I'm just gonna have you do that there. So what I'm gonna do is I'm gonna use her quad right here. There's a point on her quad that will connect in here. So you just let me know if this gets to be too much. Okay?
Nothing's too much compared to trying to walk on.
Yeah. Not fun. So in this position, this would connect here at about 93 degrees, right? But if you've watched some of my other videos, how I explain it is that, like, if she were to straighten her leg and the fascia kind of kind of pulls down or pulls up, or as she bends it more, then the fascia changes and therefore the points change. So these points connect at a certain joint angle and angle of pressure. But if you change the joint angle and angle of pressure, then you're not connecting to the spot that you were connecting to before. It connects to a different spot. Oh, that's Dora, who just jacked up my laser there.
I can't believe when I looked to see when this happened, June of 2016, I have Brian Whelton on my schedule.
Oh, you looked?
Yep, yep, because I had to find my medical records. I said, well, let me go back and see when I first met you.
Yeah. Yeah, I remember they were talking about surgery and we were able to get it so you didn't have surgery.
My friend told me find an independent physical therapist that's not associated with a doctor or a surgeon. Because then their goal is not to get me better, but just to get me to surgery.
Well, the therapist would try to get you better. Surgeons operate, that's what they do, Bend your knee for me, please, as far as it goes. So now, she's able to get, so she was at 92 degrees or so, and now she's at about 113 degrees. Do you still have pain there?
Not nearly as much, no.
Is
The
still there?
question, should I have just continued having you do my knee the whole time? That's what we should have done, right?
Yeah. Do you still have pain in there?
At this point, yeah.
At what point? Show me.
Right here.
Right there. So, and then go ahead and, so that's a little farther there. So now she's at 117. So she started off at 92 and now she's at 117. Now point to me exactly where that pain is, Betsy.
Still right there.
So she's still feeling it in there. So I got that area. So what I'm going to do, if I know I got it, I'm going to move to a different spot. So I'm going to move down here. Kind of on her shin, which is kind of not too fun to have this rub on your shin, but you let me know if it's too much, okay?
Compared to walking on my leg, there's no pain that you can do that's going to be worse than that. And I can't take any pain meds because they don't do anything for me.
Okay. Go ahead and bend for me, please. So that's...
Okay, cut it out already.
Yeah, so that's better. So we started off at 92, and now we're at 128.
I couldn't do this last week before it hurt.
128. Yeah, that's pretty good. And then bend this one. Yeah, so she's getting there, I mean, on this side, she's at, real quick, she's at, you're at 130 right there. So you're at like 10 degrees.
That won't make it go.
Do you have any pain, Betsy?
Not until I get to 128.
And then where's the pain now?
Still kind of in that same place.
So it's
I'm
still in there.
I'm wondering if my meniscus is popping out there.
Okay. And on a scale of 0 to 10 in that same place, what would you rate that pain?
5 or 6-ish.
5 or 6. So if you notice that she doesn't have pain leading up to, you know, she used to have pain at 92 degrees, but she doesn't have pain at 92 degrees. She doesn't have pain at 100 degrees. She doesn't have pain at 110 degrees. But at 128 degrees now she has pain again. So we're increasing the range of motion. We just haven't got there exactly where we need to be yet. So I'm going to stimulate a little bit more medial here and see if we can increase some range.
I'm so glad I had an appointment for my shoulder today.
All right. Now, go ahead and bend for me, please. That's a little bit more there, I would say. Now we're at 1. So we went from 128 to about, 130. 130. So she's about 8 degrees off from full range of motion. So right there, do you have pain?
No, it's more like tightness rather than pain.
Right. So that's, if you watch some of my other videos, I talk about this word, and I talk about when I teach that people will say, they have a word that people use, but when you ask them, do you have pain? They say no, but they'll say it's tight, it's hot, it's weak, it's numb, it's something, but that nobody uses the same word. But the pain, she says no. So now go ahead and stand up for me, please. And let's see how you feel.
Okay, I can go.
So, better. There we go.